The American College of Radiology.
Focused. Forward.
Together.
Hi, everyone. Thank you for joining us today. It's really great to see lots of new names and faces, and I'm seeing a bunch of a good number of radiology residency programs. My name is Brian Chang. I'm a fourth-year medical student at Drexel College of Medicine. I have the privilege of serving as chair of the medical student section for the Pennsylvania Radiologic Society, and it's my pleasure today to serve as the moderator for today's noon conference. Just one or two housekeeping notes. This webinar will be recorded and posted on the Radvocacy site. And second, if there are any questions, you can use the Q&A chat box to enter your questions, and there's a Q&A section at the end. Our first speaker is Dillon Harp. Dillon is our Senior Government Relations Specialist. He's really invaluable in coordinating and supporting state chapters of the ACR during busy legislative sessions by tracking the myriad of issues and bills that directly impact patients across 50 states. Without further ado, I'll throw it to Dillon.
Sure. Thanks, Brian. I'll echo what Brian said. Good afternoon, everyone. And it's nice to see some familiar and some new faces as well. So really my goal is in about the next 20 minutes, just really want to start talking to y'all about some current state legislation. We'll talk about some things in Pennsylvania. I'll talk about more broadly. There's a whole gambit of issues that we could spend probably a whole day on, issues that we are tracking. Myself, I guess I should stop and say myself and Eugenia Brandt, we both work on the government relations side of things. And so there's a whole gambit of issues that we track, and it's constantly ever changing. But this is a brief agenda, some things that I wanted to touch on, and then I will turn it over to my colleague, Ted. So briefly, some legislative issues that we're tracking. Really wanted to highlight a couple of these. You'll notice the ones that have asterisks by them. These are ones that are obviously huge issues to ACR, to our various state chapters across the country, but these are specifically issues that were seen as priority issues for the Pennsylvania Medical Society as well. You'll see me talking about advocacy, kind of joining forces with your state medical society when possible. Since this is in Pennsylvania, I'll be mentioning the Pennsylvania Medical Society. So really, myself and Eugenia, we each try to have our own little buckets of issues that we primarily focus on, but obviously we will cover for the other one if they are not available. But one of my big issues, scope of practice. And I've given a lot of these talks, similar talks to different radiology residency programs across the country. And always, think about different issues that are especially relevant and seem to be top of mind for a lot of the residents that I've spoken with. Scope of practice is obviously a big one. I know this is something that I'm sure that y'all are all quite familiar with. Scope of practice can mean a lot of things, right? So, normally when we're looking at it, this is the expanding the scope of practice of non-physicians. So this could be anything from PAs, advanced practice registered nurses, certified registered nurse practitioners. We've seen this start to spill into chiropractors, physical therapists, you name it. It's really really a lot of these non-physician groups who are trying to not only expand their scope to do what a MD or a DO would be doing, but specifically we're obviously taking a much keener eye when it has anything spilling over into the world of radiology as well. Again, this is one of the top issues for the Pennsylvania Medical Society as well. Some other things that are top of mind for the Pennsylvania Medical Society and ACR, we're really tracking things around non-compete, restrictive covenants. Telemedicine has always been a big issue. I think, there were some telemedicine practices across the country before COVID. Then once COVID hit, we really saw a, kind of an expansion and a relaxation of a lot of rules around telehealth and telemedicine. We've seen some of those rules be clawed back, especially kind of on the federal side of things. But we're starting to see more and more states start to adopt their own. And then, briefly, what I have listed here are some of these specific bills. These are specific in Pennsylvania under scope of practice and under kind of non-competes and restrictive covenants. But, we cover, Eugenia and myself on the state side of things, we cover a wide variety of issues. So this is, anything from breast health, cancer screening mandates. We've seen a lot of activity, especially on the cancer screening side of things, where states are trying to introduce measures that would allow patients to receive some form of cancer screenings with either no cost sharing or no copay. We do a lot of work around out-of-network, surprise billing, balance billing, different issues like that. And then, I think a big issue that is obviously dominating, not just in medicine, probably the entire world, but especially in the medical space, and specifically at ACR, we're starting to track and do a lot more research, especially on the state level, into the use of AI. And it's interesting, I look at, it really makes me think of when we're looking at another issue, prior authorization. When we're looking at prior authorization, this was a big issue that's on the federal level. On the state level, a couple of years ago, it seemed like the state of Texas was the first big state to really tackle what they thought was a good idea for prior authorizations. That they established this system, a gold carding system. And so now we're starting to see different states kind of use this Texas model to see what kind of best fits their states. And I bring that up because it's very similar in the AI space. We're starting to see different states start to adapt and implement some legislation and some regulation around how to best regulate, how to best implement AI in the healthcare space in their individual states. So briefly, after we've kind of talked about the issues, I want to talk a little bit about grassroots, grass top. By no means am I thinking that you're going to memorize these slides or anything like that, but just to kind of give you an idea, because we're going to go into a few ways that that y'all can easily get involved, depending on your comfort level, your time commitments that you have elsewhere as well. But you may hear a lot of folks at ACR. I'll mention multiple times the Pennsylvania Radiological Society. They are one of the shining beacons in the state radiological space. They have great leadership, great physician leadership, they have a great lobbyist team as a voice on the state Capitol Hill for the voice of radiology in Pennsylvania. So at any time, if anything I'm saying or you're interested, please either reach out to me, someone at the Pennsylvania Radiological Society. We work hand in hand a lot with their leadership. So please reach out to us. But ways that you can kind of tailor your message, whether you're attending a committee hearing, whether you're kind of submitting some written comments, in some of these ways that you can kind of tailor your approach best. You can tailor your message based on the approach that works best for you. Another reason, why does it matter? Why should you get involved? A lot of this stuff that we're talking about, I'll use the scope of practice again. These are going to have a direct impact on your life and on your profession and how you're able to practice in the future. Again, why does it matter? Well, why are we kind of here talking about this? Well, your elected officials, they want to hear directly from you. You're their constituent. So they want to hear from you. You'll hear me also kind of harp on that you are the issue expert. When, a piece of legislation is proposed in the medical space, something to do with imaging, they want to hear from you. You are the issue expert. One thing that I think is always really interesting to talk about, this is, they constantly gather these stats, but across the board and across the country, less than 5% of state legislators come into their elected office with some type of professional experience in healthcare. So what that tells me is, you may have someone who's a state senator in Pennsylvania or maybe in a state that you're moving to, and they were a lifelong school librarian for 40 years. Very important job, but the point being is they have no professional experience or maybe not a ton of professional knowledge in the healthcare space. So then this is a great opportunity as you're getting involved to really be that issue expert and someone that they would rely on. Before we kind of get into some steps and some ways you can get involved, a lot of folks ask, okay, we're talking about this, but does this really matter? So this was done by the Congressional Research Foundation, and they asked, this was on the federal level, but they asked staffers from both Republican, Democratic side, House, Senate side, seniority of staffers, whether they had been there for 10 years or they had been there for 10 months. What are some of, if your member has not arrived at a firm decision on the issue, how much influence might the following have? And you can see in the red outline of the box, these two, in-person visits from constituents and contact from a constituents. And so these, what we're about to delve into, these are things that you can, that are going to make the most impact. Again, 94%. I won't spend too much time on this slide. We'll talk more about this. This is just an interesting breakdown, a graph. You're in Pennsylvania, but if you were to move to a different state, these are talking about all the state legislative bodies in each state. Not all, if you've seen one state legislative body, you've seen one state legislative body. They're not all made the same. So knowing kind of the structure, some state legislative bodies, Pennsylvania is a good example, have a quite large administrative staff that can help the elected officials with research and fielding constituent calls. Some state legislative bodies, it's just the elected official. They have no help at all. So kind of knowing this can help tailor your approach. Now to get a little bit more Pennsylvania specific, there's some things you may already be familiar with, so I'll just run down this very quickly. But the Pennsylvania, the state capital, it's located in Harrisonburg, PA. There are 203 members of the House of Representatives. There's 50 members of the state Senate. I think one thing that's interesting, and going back to the slide about the how much staff outside of the elected official is in the state legislative body in PA. So this was in 2021, according to a study. The PA averages 2,324 staff members during the session. This is going to put them right at the top of some of the biggest states, California, Texas, folks like that. So there's a lot of staff members. So I think why that's important to bring up is, reach out to myself, reach out to PRS. If you do want to get in touch with your elected official, they're going to have at least one or two staff there to help them. So someone else that you can reach out to. I think one other thing that's interesting, again, each state legislative body, they have different rules and regulations on when they meet. Texas is an interesting state. They meet year round, but they meet only in odd years, only in session in odd years. Pennsylvania is a little bit unique, I think, compared to other states where they are considered a year-round legislator. But from doing some research for this talk, I found it was interesting. There were they only met sparingly from January to mid-March of the beginning of this year, actually due to a water leak in the chamber ceiling. But most of the time, they're normally, I believe, meeting from January to right till the end of November. So considered a year-round legislature. There's only about, I think, maybe 5 or 6 in the entire country that are year-round. And again, not saying, do I think you're going to remember this or memorize how many staff members are there or how many members how many members are in the Pennsylvania General Assembly, but knowing these things beforehand can help you tailor your message and help you tailor your approach. Okay, so now I want to talk about just a few ways that you could get involved. And I wanted to put, 2, 3, 4 different options, knowing that I know that the folks on this call, y'all are very busy. You're juggling your personal life, your professional life, your academic life. And so the level of involvement that one person can do is not going to be the same for everyone. So, you pick and choose how you want to get involved, reach out to us. We can help you based on kind of your comfort level and your time commitment. The first thing we're going to talk about are going to be face-to-face meetings. If you do have your smartphone available, you could scan this QR code. This will bring you to the Pennsylvania state government website where you can type in your address and your zip code, and it will tell you who all your elected officials are how you can contact them, their staff that you can contact as well. But we're talking about face-to-face meetings. Again, so these, depending on your state representative, these can be conducted in person, face-to-face, or virtually, or both. Again, we kind of talked about the COVID really relaxed a lot of rules, but I think one thing that really came out of the COVID pandemic is that a lot of state level offices and elected officials found that they can meet with their constituents, discuss issues. This can be done virtually. So we're seeing, I've seen a lot pre-COVID, during COVID, and even post-COVID, really staying with a virtual option. There's still a lot of elected officials, if they are comfortable and you're comfortable meeting face-to-face. So again, these are just kind of important to keep in mind, that virtual option may be there. When we talk about face-to-face meetings, these could be maybe joining as part of PRS's State Hill Day, where you are going with a group of folks and you're going to meet your elected representatives. But there's always tons of other opportunities to meet, quote unquote, face-to-face, whether this is in person or virtually. Your elected officials throughout the year, they'll be holding meet and greets, coffee roundtables. So there's tons of ways that you can get involved. And again, I'll belabor this point, but before your meeting, please reach out to ACR, reach out to the leadership at PRS, and we'd be happy to help with meeting prep. Another thing you'll hear me talk about is when we are going to talk about an issue, you're not going to have a ton of time, and you'll hear me say multiple times to know your ask. So just kind of keep that in the back of your head. Another way that you can get involved, let's say you don't have time to do a face-to-face meeting, or you just got other things going on. So how you can get involved by submitting testimony and submitting public comment. So if there's a piece of legislation that is being heard before a committee, you can submit your testimony. If you want to scan this QR code, this will take you, you can find your individual elected official, their staff that is assigned to healthcare, for example, and you can find out their email address and their contact information. Again, please reach out to us. We can help you with this. And something else that's, I think sometimes people don't think about, yes, you can submit public comments, but if under PA law, if by law, there must be a public comment period for at least 30 days after any rule or regulation is published in the Pennsylvania Bulletin. And during this time, this is when you can submit public comments to that respective agency. So let's say that, a piece of legislation was introduced and was passed and was recently signed into law by the governor of Pennsylvania. That agency, who would then be in charge of kind of implementing that bill, when something like that gets posted, you would have then 30 days where you could comment on it if you were going to kind of give your thoughts and opinions if you thought it was being implemented correctly or not correctly. Another way to get involved, and this is something I like to really talk about. I think it's a pretty powerful tool. I think, something especially we saw, again, pre-COVID, but actually really during COVID, was the use of social media, and how involved not only federal officials, but state level officials are on the social media front. I was doing a little bit of research and found that this was in Congress in 2021. There was almost 794,000 social media posts. So the point being is that your elected officials on the federal, but especially on the state level as well, they're staying engaged with their constituents. They're trying to keep folks updated through the use of social media about bills, issues that are going on. Through my work, working with elected officials across the country, it's a quite common practice now for a lot of elected officials to either check and monitor social media themselves about what's going on, or having either a staff member or an intern in their office whose really sole responsibility is to monitor legislation and to say, Brian in my district just has retweeted, or it's not a tweet anymore, reposted on X about this XYZ bill in the healthcare space. I'm going to check, and I see that we've actually got 15 more comments on it. So maybe this is something I should then elevate to my boss. Again, a lot of these are probably going to sound kind of common sense, so I want to go through these very quick. But, as we're talking about different ways to get involved, whether it's face-to-face, whether it's in social media, maybe it's submitting some public comments, some good things to keep in mind that will make you an effective advocate. Again, know the issue you're talking about. We talk about know your ask. So, if you don't remember anything, but that we really would like, Senator Burns to co-sponsor a piece of legislation, we know that's your ask. So, if you kind of go in and you kind of forget what you were talking about, at the end of the day, that's your ask. I think one thing that's important, especially when we're talking about advocacy with physicians, keep your comments, when you're making your comments, avoid industry jargon. So this is something that we may talk about a lot. We're very comfortable using, different acronyms or shorthanded ways of saying things. You got to remember that less than 5% of your elected officials, they're really, if they don't have a background in healthcare, you could really lose them by using some different industry jargon that they may go right over their heads. Again, these are more common sense things, but obviously you want to mind your manners. We live in a very polarized political environment in country right now, but mind your manners, always be respectful to the person you're meeting with. I think something else, a lot of the times when we're meeting with folks and they ask us a question, we want to act like we always know the answer to it. And they may ask, well, if, this bill was implemented, how many of my constituents would be impacted? If you know the answer to it, great. But if you don't, it's perfectly fine to say, Senator Chang, I don't really know the answer to that right now. But I'd be happy to get back in touch with you once I can get that information. I would say finally to remember that you are the expert on your profession. Again, this is something we've talked about. Again, if you get in there and you say, oh, I had these talking points that I wanted to say, but you know what? I forgot it. So you know what? I'm the issue expert. When there's a bill proposed that my elected official is asking me about dealing with radiology, you're living it on a daily basis. You have firsthand knowledge of it, so you can speak directly to it. And I think a big reminder too is that elected official and their staff, they like to hear and know about the great work that you're doing and how that job directly impacts a patient's quality of care, especially in their district. Again, these are some things that may be kind of self-explanatory. You may already know, but when you are advocating, being on time, being respectful. If for some reason you did have any type of personal bias towards the person you're meeting with, remember you're there to talk about that one issue, and let's say specific to radiology. You're not going to, things to avoid during your meeting, political campaigns, political contributions. And again, remember that we're talking about that one issue. When you're going to advocate with PRS or with ACR, you're there talking about radiology specific issues. You're representing yourself, PRS, ACR. And so this would not be an appropriate time to talk about another issue that may be important to you, but this would not be the best time to talk about it. And then briefly, again, we had some statistics, but I feel like another way to kind of really paint the picture of, does this work? And the question is, and the answer is to that is yes. So this happened in 2022. This was in Wisconsin. There was a bill that would allow a big group of non-physicians to basically practice independently. After it was like around 38 or 3,900 clinical hours. This was a bill that was backed by a lot of these non-physician groups. It actually passed both the Wisconsin House and the Wisconsin Senate on a bipartisan basis and quite quickly and easily. This was something that ACR and the Wisconsin Radiological Society, we advocated heavily against. And but even with our best efforts and with the Medical Society in Wisconsin and other physician specialty groups advocating against it, it passed both houses or both chambers, like I mentioned. It then was sent to the governor's desk. We kept up our advocacy efforts and really ramped them up, and especially the local radiological chapter in Wisconsin did multiple calls to actions. They sent action alerts. They sent letters. They spoke to. ACR sent multiple call to actions as well, urging the governor and his staff to really review this piece of legislation. Our members in the state of Wisconsin, again, really be those issue experts and talk about the unintended consequences that might happen. And so we were very happy as a result of ACRs, WRSs, and multiple other specialty physician groups in Wisconsin. Our advocacy efforts paid off. The governor ended up vetoing the bill. As a side note, the governor actually vetoed a very similar bill in the 2024 legislative session as well. So very briefly, real quick, before I turn it over to Ted, these are other ways for you to stay engaged. If you want to scan this QR code, this will bring you to the Radiology Advocacy Network website or RAN, where you can get information about what's going on. You can sign up to get more information from myself, from Ted, from Melody, and folks like that. These are some of our social media handles. And those are just some things to remember that we've already talked about. Again, if you want to take a quick picture of this, but this is a long-winded way of saying that at ACR and our DC team, we have folks assigned to federal, economics, state, you name it. So if you don't know exactly who to reach out to myself or someone else on this call, and we'll be able to get you connected with someone who will be able to help you out on your issue. And with that, I will turn it over to Ted.
Thank you so much, Dillon. That was actually really excellent presentation, giving us just a great overview of Radvocacy and a lot of specifics for Pennsylvania. Actually, I wasn't myself aware that the way that the Pennsylvania state legislature works is totally different from every other state, but it was really great to know. Our next speaker is Ted Burns. Ted is Senior Director of Political Affairs at RADPAC and the Advocacy Branch of the Government Relations Department. Ted hosts the TENS, lobbies, and advocates at various fundraising events on behalf of radiology and its patients. Thank you. I'll hand it over to Ted now.
Thanks so much, Brian. I appreciate the introduction. And Dillon, great job and great laying the foundation for a lot of the advocacy stuff that we all do in our office on a daily basis. But there we go. Really quickly, about the college, I don't know how many of you all know kind of the general structure of the American College of Radiology. I think it's helpful for background and context. Our headquarters is in Reston, Virginia. We have well over 300, probably 400 employees. And we have a office for residency at AIRP. And then we also have a DC office as well as the Reston office. And in our DC office, we have a legislative staff, which is our lobbying shop, our political staff, which is myself and Grace and Melody, and regulatory staff, which Dillon included on his slide with Gloria and Mike and Katie, and then state legislative and state regulatory. Now, these are kind of siloed, but at the same time, there's a lot of overlap between what we do and what the legislative staff does and what the regulatory and state legislative staff does. Dillon will see a trend in 2 or 3 different states and say, hey guys, at the federal level, you may want to keep an eye on this. Or conversely, we may see some trends at the federal level and say, hey, Dillon, maybe this is something we could try to do at the state level. Because obviously at the federal level, things don't really pass on a very regular basis. So you may see a trend at the federal or state level, but know that it may not really happen through execution of being passed through Congress and then getting signed into law. So we all kind of work in coordination with each other, even though we have small different niches. There we go. So one thing I want to talk about, and Dillon kind of mentioned a bunch of the issues that they are tracking and monitoring at the state level. Obviously, we have a lot of the similar types of issues, like I just mentioned, at the federal level, you see trends, but here's kind of the process that we go through when we're looking at, because there's so many different issues that we could look at. When you're looking at federal issues and which ones we want to prioritize and really put our resources towards, staff resources, we look at the impact on our members of the college, the radiologists, as well as the patients that our radiologists treat. Who's with us, who's against us? These are two really important questions. It's really hard to get legislation passed if you have a lot of allies, but it's really, really hard to get something passed if it's just yourself. So if you can have a lot of friends that can come to the table with you, other especially physician organizations, that makes it a lot more powerful and a lot more leverage. Who's against us? Obviously, that's a really big deal too. You look at medical liability. Well, a lot of times that has never really gotten any legs in Congress because that's an issue that we would like to fight, but we're fighting against trial lawyers, and a lot of this U.S. Senate is made up of trial attorneys, and so that makes it very difficult for pursuing that type of an issue when we know that's what we're up against. Obviously, the cost to the government. Right now, obviously, we have a huge deficit at the federal government. So if you're going to Congress and asking for a policy like, hey, we need to fix Medicare, and they're going to say, well, that sounds pretty expensive, and we already have a big budget issue as it is, that's going to be a tough ask. That's a pretty heavy lift. And so if we can come to Congress and say, hey, we have a policy that actually is going to save the government money. It's going to save Medicare money. Oh, well, now we're kind of interested. This is great. No one really comes to Congress and says we have a policy that's going to save us money. Usually people are coming to Congress and trying to push a policy that's going to cost the government money. So that's a huge level of viability that we take into consideration is the cost. And then, of course, likelihood of success. Again, going back to medical liability, we would love to continue to pursue medical liability year after year after year. It's never happened, but we know that the chances of success are pretty slim. So is that really the best way for us to utilize our resources, is chasing an issue and a policy that we just feel like is just not likely to happen? And so these are all the different criteria we kind of take into consideration when we're looking at what types of issues to prioritize at the federal level. So we want to talk about Medicare, obviously, is the big issue. It's the big thing that we've been fighting for years and years and years. If you look at kind of our most recent efforts from 2021 to 2023, we've saved about $1.6 billion in proposed imaging cuts that did not go into effect. And if you take a look at what that means for radiologists, we have about 39,000 radiology members of the American College of Radiology, give or take. That's about $41,000 per rad in saved cuts. Now, it's not that direct level of like, hey, we stopped a cut. Where's my $41,000 check in the mail? But this is kind of how it impacts practices, and then obviously the trickle down from that. The one thing I want to really emphasize, and I had mentioned it about how we look at bills and how we prioritize what issues to really focus on, and who's with us. We created a physician coalition initially to start handling the Medicare cuts, and then we expanded that coalition to provider groups. So we actually have non-MD providers included in this coalition now. And it's kind of one of these things in DC where, like, you can't ever burn a bridge. I know we're sitting here talking about scope of practice at the state level, and Dillon's worked really hard to make sure that we don't have non-MD providers, doing things that we don't think that they should be doing. At the same time, we can take a step back and talk to non-MD providers and say, yeah, we kind of all agree though that we're all being impacted by these big Medicare cuts. And so you have to make sure that you're willing to work with folks, even if you may not be in concert with them on every single possible issue. But again, having as large of a scope of support from as many different organizations as possible when you're chasing an issue is huge. And if you look at our coalition, we're now at well over 100 provider groups, and that represents well over 1 million different individual providers. And so that's very powerful to go to Congress and say, hey, look, we are all together, huge consensus on how we want to, stop these Medicare cuts from going into effect. So if you look at most recently in 2023, we were able to change what was going to be a proposed cut of specific to radiology, an 8.5% cut, and it went to only a 2% cut because of our advocacy efforts. And, a 2% cut still stinks. Don't get me wrong. We understand that that's not ideal. But we also know that that's 6.5 times of a cut better than, it could have been proposed. And so we feel pretty good about our efforts lately. There's still a ton of work to be done. But if you look at just last year alone, if you look at what does that 6.5% differential mean, it results about $437 million saved in proposed imaging cuts. So that's not insignificant. But we obviously need to think about what we need to do in the future, because there's a real fatigue up on Capitol Hill with members of Congress and their staff about every year you doc groups keep coming and asking for, stopping these cuts. And they're tired of hearing about it. Well, we're tired of lobbying about it too. And so we're looking at temporary relief, and then we're looking at longer term relief. So temporary relief until between now and the end of this year, we were able to get in legislation that was passed and signed into law again, there's going to be a cut that's in effect, that's been in effect since March of this year. That's about 2% or so differential. That's in our favor. We know it's still a cut, but again, if we can play defense, and minimize these proposed cuts the best we can in the short term, that's really all we can do until we can get to long-term relief. Now, there are some other legislative vehicles that are still active until the end of this year when it comes to short-term Medicare fix, but I don't really think any of them are going to have a chance. If you look at, again, the likelihood of success and the viability, there's an inflationary update bill that's been out for a while. That's a bill that we've been pushing for quite some time to make sure that, as inflation continues to grow, that we also see corresponding uptick for reimbursement for Medicare to help compensate for that on the expense side. But you're looking at 145 bill sponsors, which sounds great, but the reality is 107 of the 145 are Democrat House members. Well, Democrats in the House are in the minority party. So it's great to have that many Democrats on board supporting that bill, but they're not in the majority. So they're not going to probably have much success in pushing Republicans to pass that bill, because that's going to be a pretty expensive bill. And then again, looking at that slide about how we make our decisions on what bills to pursue, well, the cost is always an issue. And so that's an uphill battle on that particular bill. Looking at budget neutrality, this is an interesting bill because it's one that is actually evenly divided, bipartisan co-sponsors. There's 9 Republican and 9 Democrat co-sponsors, but there's only 18 total of them. And if you only have 18 co-sponsors on a bill, that's just not going to get it done. You have 435 House members. You really need to get close to about 200 co-sponsors to really, bipartisan co-sponsors, to really get people's attention that this is a bill that can kind of get through a pretty politically divided House and Senate, for that matter, if it were to get through the House. And then you look at trying to do an overall across-the-board increase in payments up to about 4.62%. That was a very specific reimbursement percent that was being proposed. There's 62 co-sponsors, 47 of them, more than half, are Republicans, which is good since Republicans are in the majority in the House. But the reality is 62 co-sponsors, again, is a very small number of support. And again, this is going to be a very, very expensive bill. And really, a lot of members of Congress are saying, look, we're not going to pass this bill, but we're going to increase it to 4% more when we already tried to minimize the cut that was initially proposed, where we kind of gave you guys a 2%, what they call bump, but really it's more minimizing the initial proposed cut. So while there are legislative vehicles out there to kind of address Medicare in the short term, I don't think any of these are really going to be able to get across the finish line. So what does that mean? And looking ahead, we obviously are going to need to look at something a little bit longer term, something that we can all agree on. And this is what I really try to stress with folks when we're looking at trying to fix Medicare. If you were to ask our 39,000 radiology members of the ACRA, here's 5 different options for fixing Medicare. Check your top 3 priorities. If we were to have all 39,000 do that, it'd probably be pretty hard for us to see a real consistent consensus. And that's just within the House of Radiology. Academic radiologists may feel differently than private practice radiologists. Some in a hybrid model may feel differently. So it's really hard to figure out how we're going to prioritize, just even within the House of Radiology, on how we would want to see long-term Medicare fix and what that would look like. So then if you look at that, you say, okay, well, wow, if it's really hard for us to do just within the House of Radiology, what about in the House of Dermatology or House of Anesthesiology or just the House of Medicine? If you look at all the different especially physician organizations within the House of Medicine, they're all going to have their own opinions too. Obviously, family docs are going to feel very different than specialized organizations. And so if you look at how hard it would be to find consensus within radiology, then look at how difficult it is to find consensus in the House of Medicine. And then you have to go to Capitol Hill and say, okay, we finally got consensus on all these issues to get longer term Medicare fix. Then the Congress says, yeah, we don't really agree with this. We actually think that all these consensus points that you're bringing to us aren't going to work. They're too expensive. They're not realistic, too difficult to implement, whatever the case may be. And then, so this is going to be a very, very difficult process. And it's really going to be something that is not going to be the home run. It may have to come in like, baseball analogy, hey, get a bunch of singles and doubles and try to kind of keep moving the ball forward. So it's not just all these little temporary short-term fixes, but maybe they're not going to be the big long-term forever Medicare fix, but maybe somewhere in between. But just to be realistic with folks and help folks understand just the complexity of dealing with these things on a legislative basis. If you want to look at other issues besides the Medicare reimbursement, there's certainly no shortage of them. And this is not an exhaustive list by any means. This is just a few of the issues that we're probably working on most regularly, but certainly we monitor a whole slew of issues similar to what Dillon showed at the state level. They have a whole bunch of issues, and those issues are constantly changing and very fluid. These three issues are the ones that we went to Capitol Hill Day to talk about earlier this spring, and the issues, like I said, we continue to talk about the most when we have our meetings with members of Congress, either at fundraising events or meetings in the congressional office. Workforce issues, residency slots is a big deal. We're looking at the international visa slots, all these types of things so that we can incentivize folks to get into the field of medicine. Obviously looking at rural access is a big deal. So how do we incentivize those folks to also want to get into practicing somewhere in a rural geographic location, maybe provide them some incentives with, whether it's student loan forgiveness or other ways to get them interested in it. Appropriate use criteria. This is something that we actually had a radiology resident from UPenn who came in, and I'll talk a little bit more about her in the presentation later, but she came in, she was showing me a list of all these different image exams that were ordered by the emergency department of the patient. And she's like, this is crazy. Like, all I had to do was order these two. Why did they order like 8 or whatever it was? And so we feel like there's a lot of CYA because, again, we're talking about medical liability, and it's not something that we can get coverage for as far as a legislative fix. So you see a lot of defensive medicine being practiced, and that's CYA for the practitioner, but it's also costly to the healthcare system. And it's also exposing patients to unnecessary imaging. So we want to make sure that patients are getting the right scan at the right time, and maybe in some cases, no scan at all. We feel like this is a cost saver. So if we can go to Congress and say, hey, look, if we can get this appropriate use criteria to be passed and enacted, it actually was enacted many years ago, but it was never really fully implemented. If we can get it passed with some tweaks, implemented, we think we can save a pretty significant amount of money in the billions, and that savings can then help be used as an offset for maybe a Medicare fix down the road. And then Dillon that mentioned AI. Obviously, this is a really big issue in everything you see and everything that people are doing, let alone in healthcare. But how do you regulate it? And how do you find the right balance of not regulating it too much, but making sure that there are some safeguards in place so that, patients aren't, exposed to, care that's not quality care. And one thing, so that's kind of the legislative background. And I'm going to look quickly now at the political background of things here in DC. we run RADPAC, which is the political arm of the American College of Radiology, and all the specialty physician organizations have PACs similar to RADPAC. And if you look at how much money is being raised and spent by all these PACs, it's pretty significant. And so we're talking, tons of millions of dollars every year being raised and being spent. And I always say that, members of Congress, they'll miss meetings with constituents, or they'll miss a vote on the floor, they'll miss a hearing, but members of Congress typically don't miss fundraising events because they want that check. Because if they don't get that check, they don't raise enough money to get reelected, and then they're out of a job. And so typically, if you're going to go to a fundraising event, you know that you're going to have an opportunity to have face-to-face interaction with a member of Congress. And that's when you have to really educate them. Similar to what Dillon had said at the state legislative level, that I think he said maybe 5% have a healthcare background. If you look at Congress, 535 total members of Congress, only about 6%. So similar trend as the state level. At the federal level, only 6% or so have a healthcare background. Well, that means 100% of Congress is voting on healthcare policy, but only 6% has a healthcare background. That's a lot of education that we need to do. And we can do a lot of that education when we go to fundraising events. But these fundraising events cost anywhere from $1,000 to $2,500 to $5,000 sometimes. And so, we need to raise the money so we can attend these fundraising events, because we know members of Congress will be there. So then we can educate them and build relationships with them so that we can be a trusted, honest broker with them. So if they say, Ted, I'm one of the 94% that doesn't have a healthcare background, but I've known you for 10 years, Ted, or you've been with the college for 20 years, and I've been in Congress for 20 years since you've been with radiology. How does this really work when it comes to appropriate use criteria? What does that mean? Or how does it impact providers? How does it impact patients? And help me understand that. And so if we can kind of be that liaison, because you have to remember, a lot of the congressional staff also don't have healthcare background, because a lot of the congressional staff are about 25 years old and they're right out of college. So they don't have a ton of life experience, either as a consumer of healthcare or even as someone as the healthcare background. And this is what I'm talking about. It's just such a small percentage with that background that if we don't have the resources to educate them, they're going to, get their education either from other specialty groups or from other folks who may have their own unique, self-interested role within healthcare. And we're a little bit concerned about who's going to be dictating that education process. We would much rather be involved in it ourselves. These are also ways to make a difference. Dillon had a list of things you can do. I'm going to include, obviously, contributing to RADPAC. That's an important part of the process, as I talked about, going to the fundraising events, participating in the Hill Day that we have at the ACR meeting every spring. And in most cases, I think a lot of states are starting to have their own state legislative Hill Day. Dillon would know more about that if you're interested in that. I believe PRS does that. I would strongly recommend getting involved with the ACR's Resident Fellow section and with the chapter, the PRS chapter. These are really important organizations. They're not just good for helping us, but they're also good for helping you. I mean, this is a great way to expand your network and to also have relationships so that when you're done your training and you're looking for a job and you want to stay in Pennsylvania, well, because you were involved with PRS and you're involved with the ACR's RFS, you probably have a better network and opportunity to hear about jobs, or you get a recommendation about a job that you're seeking. This is a picture of Dr. Rich. She was at UPenn, and she came as a Rutherford Fellow, so it was Pennsylvania-sponsored resident fellow. And Dr. Mary Scanlon, who's at UPenn, is very involved in helping the PRS run that program. And we got her to meet with and a picture with Congressman Richard Hudson. He's on Energy and Commerce Committee. He is chair of the NRCC, the National Republican Congressional Committee. So he's in charge of the political arm of House Republicans and getting them elected and in the majority. She also met with several Democrat House members as well. But it was a great opportunity for her to come to DC, interact with our DC staff, see all the different ways that our staff is engaged with different stakeholders in DC to try to move health policy forward that's going to be good for radiology and good for the patients of radiologists. And I'll stop there. And I guess, Bryant, we're going to keep it open for questions. Is that right?
Hi, I'm so sorry for the brief interruption there. I was fixing my microphone. Thank you so much, Ted, for that terrific talk on more of a federal level and, just the huge complexity and like everything that, the ACR does as a college and how we, I just want to say I'm so grateful that radiology has such a well-established support and network and complete organization that will, help us advocate for our patients. One question that I actually had personally was I noticed in Dillon's presentation, I believe that was at the federal level, is that the in terms of the forms of communication that are most influential to our representatives, the first two were in-person visits, but I actually noticed the third most influential, something above 90%, was actually an email. I was wondering if you either, Ted or Dillon would be able to speak to how we can go about that, just given that many of the people on this call, residents, maybe med students or attendings, might not have a ton of time for in-person visits. And I was just wondering, yes, what emails typically look like.
So I can jump in, Dillon, and then if you want to jump in after, I think having worked on the Hill, now granted it was a long time ago where you didn't get emails. We had postal bins where we put handwritten letters in it. I really feel like I sound like I'm like 100 years old, but that's kind of how we did it pre-email days. But if it's done in a kind of it's a weird balance. Like you want to have it coordinated so that there's volume. If one person, so Brian, if you sent an email to your member of Congress, just one email alone is probably not going to get much attention, no matter how personalized or how many great anecdotes you have in there or how much data you include. It's probably not going to really be, wow, we have a big problem here. We're hearing a lot from our constituents back in the district. But if you have a bunch of folks doing it, if you get everyone at UPenn to do it, let's say, within the program, now you've got, let's say, 10 or 15 or 30 different unique emails on the same type of topic. Now they're going to say, "Oh, okay, our attention is, we're kind of focused on this issue now because it's not just one random email." At the same time, if it's a clearly super coordinated effort, they take that into consideration, certainly, but it's also like, okay, well, this is almost like a campaign of sorts. And so while that can still have a lot of impact with congressional offices, at the same time, it doesn't have the same weight as maybe 5 or 10 or 20 or 30, in my opinion, more personalized emails. But I think you have to find the timing. I think you have to find the right language to use. Every member of Congress's office is a little bit uniquely different with what types of stuff they really look for and they want to see. And so I think the other part is, Dillon mentioned this and I didn't mention it at all, but I should have, is this is where it's really important to coordinate with us. So if someone has an issue and they want to get involved, the first thing they should do is reach out to me, reach out to Melody, reach out to Dillon and say, hey, this is what I'm thinking. This is what's really hot on my mind. I'm really concerned about it. I really want to have impact. What's the best way to do it? So we'll say, okay, well, who's your member of Congress or who's your state legislator? Okay, this is probably the best thing that works for that office or with that individual. And so I think we can kind of cater it a little bit that way. And it depends. Are they on a committee that has even jurisdiction on a healthcare issue? Maybe they're on the transportation committee. So they're not really going to be a viable kind of player at the table as it is anyway. Doesn't mean you don't send an email, but maybe there's another way. Maybe let's focus on your senator because maybe your senator is on the Senate Finance Committee and that has healthcare jurisdiction. So there's a lot of wrinkles to it. But certainly we understand that, you guys are extremely busy. And so before you just start going and spending a bunch of time kind of sending off random emails and you're not quite sure of the process, reach out to us and we can try to make it the most efficient and impactful way possible for you all to get involved. Dillon, I don't know if you have anything you want to add to that.
Yeah, no, I would I'm going to piggyback on what Ted said. I think he's right. It's definitely a fine line you want to walk. And again, yes, definitely reach out to us. But he's right. If it's just one person saying, there's an issue, I would say unless you have like a really good relationship with that elected official, I doubt that would really move the needle. But I think having a strong coordinated effort to where you're not going to solely rely on an email or some form of a call to action. But as that is a component and kind of a larger kind of advocacy campaign, that could really move the needle in the right direction.
That's great. Yeah, it sounds like it's definitely really important to be coordinated. And what I'm getting is definitely reach out to any one of you guys, because you guys are the pros, and just sort of have more information at your fingertips. We do have one question from the Jefferson Einstein program. I'm just going to read out their question. It seems that we are forced to be on the defensive on multiple fronts, and it feels like a game of whack-a-mole. What are your thoughts on efforts to proactively introduce legislation to protect physician rights and patient safety? Is it more an issue with cost resources versus return between these strategies?
I mean, I can go. I'm happy to go first too. I mean, I think the thing that's really hard to have an honest conversation with a lot of our members is that healthcare is just one of many, 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 many issues that members of Congress on the federal side are working on. And then within healthcare, radiology is a very small niche within the overall healthcare kind of portfolio, if you will. And so you've got that dynamic. So bringing it to the attention of legislators, getting them to really focus on it. You have the cost of healthcare. And then, quite honestly, you have the fact, and we just mentioned it, how busy you all are as professionals. I mean, you guys don't have, all this free time all day to be sending tons of emails and, going to, hearings and coming to DC and doing multiple trips to visit with members of Congress. You guys are busy. You're treating patients. You don't have time for that. But there is a certain kind of fatigue and a certain kind of apathy within the physician community as a whole, certainly within radiology, but within all medicine. And, you guys aren't going to go on a strike, right? You guys aren't going to just all of a sudden stop working. And so, usually when the what hits the fan is that's when Congress's attention gets like really focused on a particular issue. Or if something is in the media, then Congress starts to focus on it because they're hearing it from all the constituents because the constituents are hearing it in the media. But while healthcare costs are continuing to go up, it's really hard for a member of Congress. And this is, again, another hard conversation to have with people is that, like, we know that you guys are working more and more now than ever. We know that you guys haven't had a pay raise in a long, long time when it comes to Medicare. At the same time, you guys are still doing okay. And so I don't want to say there's like a lack of empathy or sympathy for what you guys are going through, but like they know docs are at the, compared to the rest of society, docs are still living a good life. They're working their butts off and they're still making a decent money, even though they haven't had an increase. And so if you look at all those different things, it's really hard to get Congress to focus on it. So a lot of us playing defense is really coming from not the legislative level. These are proposals coming from CMS, the Center for Medicare and Medicaid Services, and the CMS is proposing these cuts, and then we have to go legislatively to fix these proposed cuts coming from the regulatory side of it. So it is frustrating for us as it is frustrating for the person who asked the question why we're on the defensive instead of being on the offensive. But I would say that right now we're participating in requests for information from different Senate offices and different committees on the Hill about what does long-term Medicare look like and how can we make sure that we're again incentivizing docs to get into medicine, incentivizing them to work in rural underserved areas. And so they're putting out these calls for information and we're responding and trying to be proactive instead of only playing defense. But you're right. A lot of times we're stuck playing defense while we're trying to be proactive at the same time. But the defense is, taking care of the here and now, and being proactive is usually further down the road. And that's kind of how we have to divvy up our resources and our attention. Dillon, I don't know if you want to jump in if it's different at the state level.
Yeah, no, I would just mention, I think a lot of the similarities, it's funny, we kind of see some similar patterns on the federal and state side. As Ted mentioned, I mean, a state level, elected official, whether they're in Pennsylvania or in Louisiana, they're covering the gambit of issues. But I will say, kind of to that question around being defensive, and we've started to see other states, other state medical societies, other state physician specialty organizations really start to kind of change their approach and their mindset around specifically scope of practice. So there's a bill that was introduced and is currently still active in the state of Michigan, dealing with scope of practice. Because you're right, on the scope of practice fund, it does seem like we're on the defensive all the time. We're always advocating or testifying or doing a call to action, saying, why X group should not be able to practice independently. But in Michigan, they proposed a bill that actually stated very clearly that a physician, so either an MD or a DO, should be the head of the physician of a healthcare-led team, of a physician-led team, and a physician should be the kind of that leader in that. So I think getting creative around introducing some more offensive legislation, I guess, so to speak, than being on the defensive all the time, is one way that I think moving forward that we should really start to focus our time and attention towards.
Thank you, Ted and Dillon, for your really insightful answers. We're a little bit past 1 right now, but so I want to just really thank Dillon, Ted, both for your really informative talks. I hope this was informative for anybody on the call as it was for me. I also want to thank Melody, who has helped us a ton with the technical aspects of this webinar. And I believe in just a short second there, the link to the Radvocacy site where this recording was posted will be in the chat for anybody that wants to watch this recording again. And just the last thank you to the PRS RAN for putting this event on. Yeah, I think that'll be it. Thank you so much, everybody, for joining, and have a great rest of your day. Thank you.
Thanks, guys.
The American College of Radiology.
Focused. Forward.
Together.